I will make that setting change for you. So thank you all for joining us. As always, we know you guys have a lot to cover. So thank you so much for taking time out, because we think this is really interesting and relevant, especially going into the flu season that we're about to get into, as we've already seen some colder temperatures. So today we're going to feature two physicians from UNC Health who will discuss the upcoming flu season, what to expect around that during a global pandemic, and just everything that we think is going to go into it, and all the things that kind of cross over. So as we do that, just to give you a reminder on the logistics, we are recording the meeting, and then as soon as it's over, we will upload both an audio and a separate video file to a Dropbox account, and we'll send you those links so you can get those if you need them. And we'll get those, within 30 minutes of the meeting ending. And those will be available to you. And those are always, as always, they're completely unedited. So you can use them as if you shot them or recorded them yourself. So at this point, I will turn this over to my co-host, Alan Wolf, as this is our 25th media briefing since April. Alan?
Wow, time flies. Thanks, Phil. Good morning, everybody. Thanks for joining us. Dr. Amir Barzan is a family medicine physician at UNC Health. He currently oversees testing for COVID-19 at the Respiratory Diagnostic Center in Chapel Hill, in addition to taking care of patients both in his practice and urgent cares. Dr. Cheryl Jackson is Chief Division of Pediatric Emergency Medicine and a professor of pediatrics at the UNC School of Medicine. She is Medical Director of the Pediatric Emergency Department at UNC Medical Center in Chapel Hill, as well as Medical Director of the new Children's Urgent Care in Raleigh. Thank you both for taking time out of your day to help raise some awareness and provide some education about flu season. Dr. Jackson, do you want to kick it off with a few opening remarks?
Sure. Welcome, everybody. This is the time of year that I brief my team, and I usually start off with "Winter is coming." That's not just an expression for Game of Thrones. It's something that we pay particular attention to in both pediatrics, pediatric emergency medicine, urgent care, and emergency medicine. Winter heralds the beginning of respiratory viral season, and with that, influenza. This year, it's going to be complicated by COVID. And so this is the beginning of a lot of preparedness. We always hope for the best, but prepare for the worst. And we're doing that in our clinics, in the urgent cares, in the emergency department, in the healthcare system, to make sure that healthcare workers and patients in particular are safe as can be. So I will kick it over to Amir to let him do his introductory remarks, but I'm sure there will be a lot of questions about what we're doing to prepare for flu and this season too.
Thank you, Dr. Jackson. It's always a pleasure to be able to do this, and I think very well said and very well spoken about what we're thinking about from healthcare providers. This is normally a time as a primary care physician and someone who works in outpatient settings, urgent care settings, inpatient settings, taking care of people who are hospitalized, where we do see an increase in number of cases of viral illnesses that could cause respiratory illness. So that you need to be able to better educate the public at large, but also to be able to provide really meaningful insight, hopefully, in the things that we can do, in my mind, as a primary care physician, which is really important, is I think the best treatment is prevention. And so hopefully giving people tips and tricks and how to be able to prevent this concomitant issue that we may have with both flu season running over with what we're dealing in our current pandemic state with coronavirus. So thanks for giving us the opportunity, and looking forward to talking to everyone.
Happy to open it up to media questions. Just take yourself off mute and step right up.
Hi, good morning. This is Richard Stradling at the News and Observer. Thanks for doing this. Can you talk about how coronavirus and the flu are similar and how they are different?
Absolutely. Cheryl, if it's okay, I'll start and you feel free to jump in. So I think that that's a very wonderful question to ask, because one that we're hearing a lot about on the ground. If you think about, in principle, what we think of in terms of symptoms, fever, body aches, fatigue, cough, shortness of breath, runny nose, headache, you can see that in both flu and the coronavirus. So I think one of the things that we're working on in terms of talking through as a medical community is what can we do to try to narrow in on some potential medical concerns that may lean us one way or the other. It's a little bit difficult to be able to do that. So I think that's one of the reasons why we are really trying to educate people on the importance of doing the things that protect you from both viruses. And so the measures that we have taken in place over the past few months to keep the people of North Carolina safe, washing your hands, keeping distance, wearing a mask when you can't do those two other things, those should, in theory, protect you against both of these diseases. So we really are trying to make sure that we're promoting the health of our communities through that. In terms of the symptoms, like we mentioned here, a lot of these may be running together. So that's why it's important to talk to your physician when you are feeling sick to see, could it be one, could it be the other? What are the options on the table?
Yeah, and I would just jump in that the other thing that we can do is we do have a vaccine to prevent influenza A and B. And so to help mitigate the effects of potentially getting two viruses, what you can do is get a flu vaccine. And what we're doing here at the medical center, and I'm sure at a number of primary care offices, as well as in our urgent cares, will be to ramp up our ability to offer the flu vaccine to the community. And it is super, super important to prevent at least one of those diseases. There's a lot of talk in the media about hopefully getting a coronavirus vaccine, but we know that yearly there are millions of people around the world and in the United States who get influenza, and it has a high mortality and morbidity associated with it. We don't know at this time what the impact of having coronavirus and possibly the flu at the same time will be, but it's really important to prevent what you can.
Hi there, my name's Judith. I'm with CBS 17 here in Raleigh. You know, there are some companies that have announced that they're going to be doing some combined flu and COVID-19 testing. Can you guys just kind of talk about your thoughts about that and benefits to that?
Yeah,
Sure.
absolutely.
Go on.
Go ahead.
Yes, I mean, it's obviously wonderful to be able to do one test on, or multiple tests on one swab. There are companies that have announced that they will be doing that. We will also be doing, similarly, we will have tests available at the medical center that will be able to test for both influenza and coronavirus, or influenza, influenza, coronavirus, and RSV, which is a respiratory virus that impacts small children in particular, and also a test that will test for a whole panel of respiratory pathogens as well as coronavirus, and that can be done on one swab. So it is important. We try to minimize discomfort to patients when we can. It's also more efficient so that you're not kind of coming back, well, did you do this or did you think about that? So I think it's a good thing that these tests are going to be out there, and hopefully all of them have been appropriately validated as well.
Yeah, and just to jump on with the same kind of sentiment there, is that when we first started looking at this at the very early parts of the pandemic, what we noticed is that what we were doing here at UNC Health is that we were running many of the tests that Dr. Jackson just mentioned. So what we were testing for initially was flu and RSV, and then also running a coronavirus test if necessary. We were running that on two separate tests, but we could use one specimen. You can imagine as we incorporate these into one test, what that does is it helps the supply chain quite a bit. So the ability to kind of streamline the impacts that we may have on the downstream effects, we want to have the ability to diagnose efficiently, open to everyone who needs it. And the more we can do to streamline that and to make it easier to get a diagnosis, the more likely we are to be able to save the necessary supplies that we have to get us through not only this flu season, but then potentially afterwards if we're still dealing with flu and coronavirus. So excited to see if the combination tests that are coming on board. We'll do that for our reagents and our supply chain, but really a big proponent of trying to minimize any harm to patients and any discomfort to patients as much as possible. And one swab is better than two. So we're really lucky to be able to do it off of one.
And this is Judith again.
we have-
Oops, sorry.
No, go ahead, Judith. Go ahead.
Just another question is when it comes to hospital capacity, people are hospitalized every year for flu, and now we have COVID. Is there any worry or concern about hospital capacities or getting an influx of people when flu season really starts to ramp up?
Yeah, we can kind of talk about it from two different angles, and I'll let Dr. Jackson kind of talk about what she sees in the emergency room normally during this time. What we see on the outpatient and inpatient side of things that I work on is this is the time of year where we typically see an increase in volume in the hospital due to respiratory illness. And so one of the reasons why this is so important for us to talk about what we can do to prevent illness, like getting an immunization for the flu, is because as you very well stated in your question, there is a limited set of resources that you have. And so for every bed that a patient who has influenza sits in, that's one less bed that could be used for someone with an appendectomy that needs to happen, or someone with coronavirus that needs to get care. So we are very much looking at this from a holistic point of view. We want to try to streamline the care for patients as best as possible. We also want to provide the best resources for them across the UNC Health atmosphere. And that means what we can do is try to prevent cases of influenza if we can, so that we don't run into this situation where we are running into a capacity issue.
We had a question from Rose Hoban. I think her first question, actually, I think you just answered. But could you, the two of you, talk a little bit more about how people wearing masks and practicing physical distancing for COVID might affect the transmission of flu as well as COVID? Do you expect to see lower numbers, maybe?
That is the hope. One thing about this time of year is we make a lot of predictions and then we see how it plays out. Certainly the universal precautions, wearing a mask, wearing gloves, wearing gowns when we're in the hospital, wearing eyewear, are designed to prevent transmission of infection. In the community, washing your hands, social distancing, and wearing masks will do the same. And it absolutely will prevent or slow down the transmission of influenza as well as coronavirus and other viruses. And in fact, at the beginning of the coronavirus pandemic, at the beginning of the year, we were in the midst of flu season, and I don't know what happened. Can you guys still hear me?
Yeah, you're fine. We can see you and hear you. Yeah, you're good.
For some reason, my screen just went away. But we were in the middle of flu season, and flu season quickly ramped down as once the stay-at-home order went into effect. So we are very hopeful that influenza season and respiratory viral season will be mitigated if people continue to social distance, wear their masks, wash their hands. However, if they don't, it's possible that it could be worse. So we shall see.
Any questions from the media? I've got a text question, but if you want to just step right up, go ahead. I see Richard. Do you have a question?
Well, this is along those lines. So if I am wearing a mask and social distancing and washing my hands, do I still need to get a flu shot?
Yeah, that's a great question. And yes, and there's multiple reasons why. So what we know about giving yourself the best chance to succeed from a healthcare standpoint, if we were to look at across the population in North Carolina, one of the things that you can do to do the best that you can to prevent disease is to take the care that you can, and thinking about what are the most available methods for prevention that are out there. And the influenza vaccine is a great preventative measure to help people from getting the flu. So yes, while these other measures are really important, I think of them as other things that can occur downstream to protect us from disease. Start with the prevention method and try to go down the route of saying immunization is important. Then after immunization, you're taking kind of into your hands, in your own control, the ability to take care of yourself by giving yourself the best chance to succeed. And then you layer on that these other elements of wearing a mask, staying distant, washing your hands, and you further increase your chances of staying safer and healthier. The other thing that I think is really important about this is when we look at people, so let's say if you were to get the flu vaccine and you ended up being that unlucky person that also got influenza on top of that, your chances of having a severe illness is much less than those who did not receive the vaccine. So even in the worst case scenario, you're still helping yourself out from taking control of your health and being able to protect yourself as best as possible. So absolutely go and get your vaccines. Find the best place for yourself to do that. All of our primary care sites at the UNC Health clinics are working on trying to make sure that that's done in the safest and most efficient way possible. Pharmacies are doing that too. Our distancing measures that we have in place make it very, very safe for people to get vaccines. So we are very much highly encouraging the continued vaccination for influenza.
I would also emphasize, I'm not a real big sports person, but a little thing I do know is that people train long and hard to win the game. So, I mean, the goal is to win the respiratory viral season. That means it comes and it goes and you did not get sick. So just like playing any sport, whether individual or team, you're gonna do everything you can to prepare to win. So to win the respiratory viral season, you need to protect yourself, and that would include getting an influenza vaccine. You need to use appropriate hygiene measures, and that would include wearing a mask, staying away from people who are sick. When you do get sick, keeping yourself indoors and don't send your kids to school and daycare with a suspected fever. Give them Tylenol, get to work and come home, and then take them to the doctor. You've just exposed about 20 other kids. So do everything you can to win the respiratory viral season, not just one thing. It's the same as you would do if you were preparing for the big game. You're not just going to practice passing or dribbling. You're going to practice it all, and you're going to do it all so that you can ultimately win the respiratory viral season.
We had a question from Rose Hoban, and Rose was asking, what are the supplies of PPE like now at UNC and in the larger medical community?
Yeah, we have been really lucky. Thank you to the state of North Carolina and the citizens for getting us to this point. I feel like our governor has done an amazing job of putting in the orders that he did whenever he did to help us try to prepare for this. This was really hard to see in February and March when we had such supply shortages, but all the measures that we've taken into effect right now, keeping people out of the hospitals, have allowed us to really ramp up our ability to get caught up in the supply chain. And when I say supply chain, that doesn't only mean PPE, but it also means things like testing supplies, the ability to have safe places for people to be seen to get their chronic care, et cetera. So that, I think, has been one of the best parts about this, is we really are seeing the benefits of what we did early in the year play out now with getting our supply chains back up. It's helped the manufacturing companies across the country and across the world really catch up to that initial surge in demand that we had. So currently we're in a really good position to be able to have the appropriate PPE necessary to take care of patients, for both keeping the clinicians and the staff that are taking care of them safe, but also the patients and their family members safe as well.
This is Judith again at CBS 17. Are you guys doing anything different this year in your preparation for the flu because of the pandemic?
One different thing that we're doing, we don't usually do in the emergency department, is we are actually offering, we will be giving out flu vaccines when appropriate in the emergency department. We usually refer people back to their primary care givers, but at this time, we've made a decision that we think it is important enough to get people vaccinated that, looking at our numbers, there are enough people that show up at the emergency department unvaccinated that it makes sense to get people and capture this group when we can. So that is one thing that we're doing different. Anything else you can think of, Amir?
Yeah, I think a lot of what we've done in the outpatient settings to kind of prepare for COVID are preparing us to do better and more efficient flu vaccinations and or care for people with respiratory illnesses. So for example, one of the things that I think has been really helpful that we're going to reap the benefits of is we've really worked a lot across the entire healthcare system here at UNC to limit congregation of patients and things like waiting rooms and making sure that scheduled appointments are appropriately distanced in space. So what we're doing is providing, I think, probably the safest environment that we've had in years that I've worked here that give us the ability to provide the care for patients, one, but also two, for that person who wants to come in and get their immunization for influenza, you could do it in a really safe manner. So I actually think that a lot of this playing into that preparation has made us better. What we've done in terms of working through the COVID pandemic is really preparing us to do better on the influenza side of the house. Other things that we're exploring as a healthcare system is just how can we do faster and safer immunizations on larger scale. So there's discussions on how we can do that in different models, whether that be outdoor models or drive-through models, just thinking through what those potentials could be. We're trying to do the best that we can to meet patients in the way that they want to receive care.
And the planning I discussed has been going on for a while. So not only has the healthcare system been thinking since the beginning of the year about PPE supplies. It was also what testing supplies would we need, what vaccines. So there have been estimates about what we would need, and these have been ordered, and we anticipate that we'll have an appropriate number of testing supplies, vaccines, and then a distribution model to get it out to the public, as well as our healthcare workers, which we also want to be safe.
Can you, I don't know if Spectrum was going to say something. This is Judith again. Is there one thing that people should be looking out for, like one symptom that you can know you have COVID versus a flu? Is there any one thing that stands out? I know a lot of the symptoms are the same.
Yeah, I wish I could tell you. I think Cheryl and I have had conversations about this where we were like, I wish there was that one thing that we could say. What we do know that I think is also helpful to think of, we do have anti-infective treatment options for the flu. So while we can't necessarily say this is definitely flu or this is definitely COVID, what we do want to be able to tell patients is what can we do to prevent one versus the other, which is why we're talking so much about immunizations. But then two, if you do have influenza and we catch it early enough, we do have treatment options available to help shorten the duration of symptoms. And all of that plays in well to continuing to limit spread, but also getting people to feeling better quicker and hopefully limiting severe disease. So I wish I had that magic, this is the one symptom that I would say this is 100% flu or this is 100% COVID. But we're learning as a healthcare system how to kind of evaluate people for both as well.
One thing I would also emphasize is that if someone does get sick, the importance of seeking care early. So the treatments for influenza work much better when they're given early. Again, that is not to say that you should not try to prevent it by getting influenza vaccine. However, if you do or if you or a loved one finds himself ill, then you do need to seek care early. One of the things that has happened that I think has been awesome, and Amir and I were talking about at the very beginning, before all of you came on the call, was the ramping up of video visits. So a lot of primary care offices have video visits. Our children's urgent care, we do video visits up until midnight with a pediatric specialist for parents that are concerned, who can also help triage whether or not a patient, which means sort and decide whether a patient needs to go to the emergency department that evening, can schedule a primary care visit, or they're okay to stay home. So I would utilize those resources with video visits, with primary care doctors, with urgent cares, to help make that decision to seek care early. And sometimes that can help mitigate the influx in the emergency department so we can save the emergency department for the sickest patients. And again, if you need to see the doctor, and you really need to see the doctor, go see the doctor. But there are a variety of ways you can have access to your physician these days, including the video visits, including urgent cares. So I would utilize those across the system as well.
This is Will. Oh,
Go ahead, Will. Go ahead, please.
this is Will Michaels at WUNC. Just out of curiosity, this is sort of a broader question, but do you think that some of these new things that you're adopting during the pandemic, prevention protocols, distribution, and protection, will be lasting changes in the medical community, or is this really something that is just going to last through the pandemic?
Can I take this, Amir?
Please.
So my gray hair is not just for show. I've been around for a long time, and also discussing with a nurse who is senior as well. I started medicine at the beginning of the HIV AIDS coming into play in the United States, and it was at that time that the term universal precautions came into play a couple of years into the AIDS epidemic. Prior to that, when I first started medical school, believe it or not, you didn't wear gloves drawing blood or starting IV. You didn't necessarily put on gowns, and certainly you used masks for surgery. Now, 30 years later, we routinely will put on gloves to start IVs and wear gowns. We now have what's called universal pandemic precautions, where we wear masks and we wear eyewear to prevent ourselves and others from transmitting infections. And I would be shocked if we went backwards. It is actually really good infection control policy. We've always washed our hands, but there are times, and I think it's been emphasized now to healthcare workers, the importance of using those precautions that have actually always been in place, but I think we've adhered to them more rigorously than usual. The safety practices that we put in waiting rooms of outpatient clinics are just super important, and they've always been in place to a certain extent. We've been much more rigorous about it during COVID, and I don't see any reason to go backwards, and I doubt that we will. You can add on, Amir.
No, I think that you said it exactly correct. I mean, I'm sitting in my office right now, and I'm looking to the corner of my desk, and I have 5 masks on the corner of my desk. If you would have told me that I would have 5 masks sitting in the corner of my desk, where I also have a bunch of cloth masks at home, multiple in my car that I use whenever I'm out and about too, if I can't distance, I wouldn't have never thought about this. And so these are all things that I think we're getting used to as a medical community, because our primary job and what we do is we need to keep ourselves safe so we can do the best that we can to take care of people who need us most. And so we're kind of turning in that tide. And I agree. I think it would be really hard to say, come February, all of this goes away. I think we're stuck in this rut in terms of trying to make sure that we're doing everything that we can to be safe as possible for people. And this opportunity in front of us is, let's do what we can to wear the protective equipment that keeps us safe. So I think we will be in this for quite some time. I really appreciated Cheryl explaining what she had been through, because it's a valuable lesson in terms of time being experienced. And I do agree that we're going to have that same kind of notion over time.
So go ahead. I'm sorry. Go ahead, Dr. Jackson, please.
I was going to say, if you think about it, every flu season, I'm sure Amir can attest to this, that I see patients say, well, I don't know how I got sick. And I would always say, do you go to the grocery store? Do you go other places? So even though people are usually pretty careful, this whole idea of not coughing into your hand and then shaking someone else's hand, or coughing into your hand and then handling all the fruit in the grocery store, is really important to preventing the spread of infection. So having people do basic protection methods, like stay home when they're sick, wear a mask if they're sick, cough or sneeze into their elbow instead of their hand, dispose of their tissues, clean off their shopping carts. All of those things are good to help mitigate the spread of infection throughout the community. community, whether it's the common cold, influenza, coronavirus, or a host of other viruses that are around and will probably evolve over time.
So we're out of time, but I wanted to just give one more opportunity. If there's any media that had a question and was not didn't get the opportunity to ask it. So was there any final media question? If not, I think we will conclude today's briefing. Thank you both very much for being with us. It was very helpful. I think our audience found it interesting. Also, to let the media know, as usual, we will upload a recording of both the video and the audio, 2 separate files, as quick as we can get that out, which should be in the next 30 minutes or so. And those, as always, are unedited, so you can use those at your discretion. And we thank you for joining us again today. And this concludes our media briefing from UNC Health. Thank you so much.